Hello, everybody. Good afternoon. It's Monday. Welcome to the weekly coronavirus update. I'm Dr. Jeffrey Galvin. We are doing things old school today, back at the house. Mondays at our clinic is pretty much an admin day. I see people are acutely ill, but we don't have regularly scheduled patients. So we've been working out of the house, and that's what we did today. So a little casual today. For those of you just joining us, my name is Jeffrey Galvin. I'm a board-certified emergency medicine and functional medicine doctor here in just outside of Charlotte, North Carolina. And I've been doing updates about the virus since it all started way back when. Today, what we're going to do is we're going to talk a little bit about the numbers, and also we're going to talk about long haulers. People have had symptoms for quite a while. As usual, if you find this valuable, please subscribe to our YouTube channel or follow us on Facebook and hit the little bell on YouTube so you'll be informed when we release new videos. First off, as usual, we're going to start with the numbers. 20 million cases worldwide, 732,000 deaths. Here in the U.S., we've crossed 5 million. I think we're at 5.1 million cases. 165,000 deaths in my state of North Carolina. 136,000 cases, around 2,172 deaths. Now, the hospital numbers here have been pretty steady. They've been running around 1,100 or so pretty consistently for the last week or so, but I have noticed that our positivity rate of our tests has been dropping. We talked about this a few weeks ago. We were running around 10%, and then it dropped down to about 8%, and it bounced up a little bit, and now it's actually, the last 2 days has been 6% and 5%. Now, they were over the weekend, so I'm not sure, but it's certainly down to at least 7%, which is an improvement, and it may be showing us that what's happening is all these things we're doing, social distancing, masking, all these things are starting to have an effect that we're lowering the new case numbers, which is great. Let's talk a little bit about this phenomenon known as COVID long haulers. And we actually have a couple patients that have had symptoms consistent with this, including one in particular that's had symptoms for quite a while. The idea is that, about 80% of people that develop COVID either have mild symptoms or are asymptomatic. When we say mild symptoms, meaning that, they may be sick, but they're not sick enough to have to go to the hospital. They may get fatigue, fevers, cough, but, be sick at home, but not needing to be admitted to the hospital. So 80% of people, that's what's going to happen. And then the rest, may need to be in the hospital, may need to go to the emergency department. A fraction of those are going to get admitted, and a tiny fraction of those may go on to have really severe disease. But, the majority of people are going to get the virus and they're going to recover. Well, what we're seeing now is a fair number of people that are developing the virus, and then, instead of it lasting for a week or two like it does for most people, they actually end up with symptoms for, many more weeks or even months afterwards. And I'm going to just turn this, I forgot to turn my light on. Oh, is that better? Sorry about that. Forgot to turn my light on. Anyway, so they can have these symptoms for a lot longer. And the interesting thing is that a lot of them are a little bit bizarre. Some of them are neurologic, some of them are related to breathing problems and other things. The most common symptoms, it seems to be, and this is, I guess it's fairly scientific. There was a researcher from, I believe, the University of Indiana, who actually did a great thing. There's a Facebook page of COVID survivors that has about 81,000 members. And this researcher did a poll on that site asking about this. And I believe something like 1,500 or 1,600 people reported continued symptoms. And interestingly, the 6 most common things were, number 1 was fatigue. Number 2 was body aches or muscle aches. Number 3 was shortness of breath. Number 4 was difficulty concentrating or focusing. Number 5, inability to exercise or be active. And number 6 was headache. And interestingly enough, number 5 and 6, this difficulty concentrating and the inability to exercise, are actually not even CDC recognized symptoms of COVID, but it's actually very interesting because it's actually what we've seen in a couple of our patients that have had prolonged symptoms as well. And it just, goes to show you that this is kind of a crazy virus, and we're learning more every day because it's new and it's only been around for 6 months or so, and we're learning. There was a study that was published in JAMA out of Italy that looked at, I'm going to make sure I got my numbers right, 143 patients, and 87% of those patients actually reported at least one residual symptom a month afterwards. So it seems like it's fairly common for people to have sort of these prolonged symptoms. The interesting thing is our patient has been having some strange neurologic things, almost stroke-like symptoms, weakness and numbness in their extremities. And this person was ill, 6 weeks ago maybe, and is still having symptoms. I think one of the frustrations that people that are dealing with sort of this long hauler problem is that many doctors don't believe them. So they go and they say, I've got these symptoms, and I've seen it reported quite a bit that their physicians just don't understand that it's a real thing, and unfortunately they kind of tend not to believe them. We need to listen to our patients, and this is a legitimate, real thing. It's being reported all across the country, and it's even been shown, in some children as well. Remember, children are much less likely to develop severe disease, but they still get it, and even some of those kids are starting to have some prolonged symptoms. I think just popular culture, Alyssa Milano just came out and said that she was, went to the ER because she was having chest pain, and she had, I think, was diagnosed with COVID, back in April, and she's still having symptoms. So I think this will be something you'll probably hear more and more, because it sounds like it's something that's relatively widespread, and we're seeing it. A couple other little tidbits. New Zealand, it did a very tough lockdown initially, kind of locked off their island. Remember, they're an island, so that their ability to protect against the virus is a little bit higher. But they've gone 100 days now without a new case, which is pretty cool. A couple tips about masks and comments about masks. If you see people with the N95 mask with a little vent on it, that's really not helping anybody. And the reason is that vent does not filter anything. And so remember, we're wearing these masks to hopefully prevent spread to other people. So it's not really to prevent people from giving it to us, it's to prevent us to giving other people. And if you've got a vent on your mask, that little plastic, looks like a little plastic square in the front or on the side, what's happening is that's unfiltered air that's coming out. So it's basically the same as wearing no mask at all. So if you've got the N95 mask with a vent on it, don't use it. We don't use them in the hospital. They're not protecting anybody. It defeats the purpose. I had a viewer ask a question about doctors' offices and what masks the doctors should be wearing. And they asked me, should their doctor be wearing an N95 mask? And honestly, I don't always wear an N95 mask in our clinic, because if it's a healthy person who is not having any symptoms of COVID, then I'm really wearing masks as a protection of transmitting any potential thing to them. When I'm in the emergency department, I wear an N95 mask all the time, and actually very often an N95 mask plus a cloth mask over it, plus a face shield and everything else. That's because we're getting exposed to people that very possibly have the virus. So the N95 mask is to protect me, hopefully, from getting it from somebody who's sick with COVID. Now, will it protect that person, the other way as well? Yeah, it will. But really, that's not the point. The point is that, if I'm asymptomatic and I don't think I have it, and you're asymptomatic and you don't think that you have it, we're wearing those masks on the off chance that one of us has been infected and is in that sort of asymptomatic phase. And the idea is that we can block those respiratory droplets. We're going to, potentially prevent each other from giving it to each other should one of us have it. It's a very different situation when you're in an emergency department treating someone that you have a highly suspicious case, you're highly suspicious have COVID, then that's a whole other level of protection. And really, the protective stuff that we're wearing is really meant to protect me, not the patient. Although there is a two-way part of that, but that's, again, not the reason I'm wearing it. I'm going to stop it there. We'll be back towards the end of the week with another one, and we will be doing a wellness topic this week. I believe we're going to start we're doing hormones. So I think this week we're going to do estrogen and progesterone and hormone replacement. So that should be an interesting topic. Hopefully we'll post that on Wednesday, depending on what the schedule looks like. In the meantime, everybody, wear your mask, wash your hands, look out for yourselves, look out for your families, look out for those around you. We're going to get through this. Let's work together, and I will talk to you soon. Have a great day.